Hi, my name is Shauna Roth, and I'm a manager with ECRI Institute's Health Technology Assessment Group. When it comes to detecting colorectal cancer, accuracy is critical. Today, the evidence points to invasive methods as being more accurate for colorectal cancer screening than non-invasive methods. However, a new test that detects colorectal cancer DNA was recently introduced. This begs the question, how accurate is it, and can it stand up to colonoscopy? These are the questions that we set out to address in our recently published report, and what follows is a summary of our findings. Patients use the Cologuard kit, which is prescribed to them by a physician, to collect a sample at home. The patient then sends the sample to Exact Sciences for analysis, where they detect abnormal DNA and blood, both of which are signs of colorectal cancer. The physician then receives the results and shares them with the patient. If the patient received positive test results, then the physician would recommend a follow-up colonoscopy, which would be diagnostic, and confirm the test results. If the patient received negative test results, then the physician would recommend that they continue colorectal cancer screening with either Cologuard once every 3 years or with another colorectal cancer screening method at its recommended interval. The possible advantages of Cologuard are improved accuracy over other non-invasive tests. The potential disadvantages are lower accuracy than invasive tests such as colonoscopy and possible false test results. A false test result would be missing a case of cancer, which would be a false negative, or a patient being told that they may have cancer when they in fact don't, which would be a false positive. We searched the published clinical literature for studies that compared Cologuard to other colorectal cancer screening methods. We found one study that compared Cologuard to fecal immunochemical testing, which is another non-invasive method. We found no studies that compared Cologuard to any other invasive or non-invasive method, including colonoscopy, which is the gold standard. We thought the most important outcomes to analyze included colorectal cancer-related mortality, sensitivity for detecting colorectal cancer, sensitivity for detecting precancerous lesions, and specificity for detecting the absence of colorectal cancer and precancerous lesions. We also assessed the strength of evidence supporting our conclusions using a grade-based method. GRADE is recognized as the highest standard for strength of evidence assessment. We concluded that Cologuard was more sensitive than fecal immunochemical testing for detecting colorectal cancer and precancerous lesions. This means that more cases of cancer and precancerous lesions will be detected in patient populations screened with Cologuard. However, Cologuard was less specific for detecting precancerous lesions and colorectal cancer than fecal immunochemical testing. This means that when Cologuard is used, more false positive cases will occur. We graded the strength of evidence supporting these conclusions as moderate. Because no studies were long enough, we were unable to determine whether Cologuard reduced colorectal cancer-related mortality. If you're interested in learning more about how ECRI Institute can help you make informed decisions on the latest drugs, devices, genetic tests, procedures, and processes, please use the contact information at the end of this video. Thank you.